Hey guys, we're going to do a modified glenohumeral or shoulder joint cars here. This is for anybody who has an issue with any kind of nerve stuff, or if they're getting tingling numbness. We still want you to get to move your shoulder, and so with this exercise we're going to modify it so we can actually do it. The other way that I do this one is if I'm on a plane, it's very hard to get a full range, so I often do a bent elbow to use that. Right, so what we're going to do, you can be seated, standing, on the ground, on a chair, whatever works. We're going to be using this right arm. Just as we normally would, we're going to come up into flexion to our end range, and we're going to get where our block is. And then as we start to rotate out, if you feel that nerve or the need to bend. Now, the ultimate goal is to have a straight arm, but for now, we just want to get some shoulder motion. Bend that elbow and drive that elbow back as you internally rotate. See my hand coming in, reaching. I keep coming back behind. So now my hand, you can see it popping out on this side, is behind my back. I'm then going to reverse that. So I'm going to lift straight off my back, coming out, elbow there, externally rotate as I drive back up and then back through. We'll do that again. Coming all the way up to your end range of flexion when you need to bend. Good, drive that elbow back, internally rotate that shoulder to your end range, then reach behind. And reverse, lift off, pull that back, externally rotate that shoulder up and reach up into flexion and back around. I'm going to show you from the side. So we're going to come up into flexion. When we reach that block or that need or that pain, bend that elbow, drive that elbow back, and internally rotate as you reach behind to the small of the back. We're going to lift that off, and we're going to be pulling back, trying to work up that end range as we can, and through. Now this is a glenohumeral shoulder modification for anyone that has a nerve issue where they're shooting sharp pain, or if you've got an issue where your elbow has an issue or restricted in space. Because what we're focusing on is getting some motion to that glenohumeral joint. Again, the ultimate goal is a straight arm rotation all the way around, but this is a great modification for when you can't do that. Coming all the way up, bend that elbow, internally rotate, reach for that end range, and come all the way back and around. Try doing 6 to 8 reps on the affected shoulder.